Hi, I'm Dr. Anders Brüggemann. I'm a recon surgeon at Uppsala University Hospital in Sweden, and I'm here to talk about our JBJS article, Risk of Revision After Arthroplasty Associated with a Specific Gene Loci. Now, our study was inspired by the findings of candidate-driven studies that identified certain single nucleotide polymorphisms, or SNPs, in predefined gene regions that were associated with the risk for revision surgery. Yet hitherto there was no GWAS that could identify any SNPs associated with the risk for revision, so we simply performed our own GWAS. Now, a GWAS, as you might recall, is the ultimate fishing expedition where you simply take all of your cases, those patients undergoing revision surgery, and you compare those with the controls, that are those patients that remained revision free. And you check for the whole human genome, and at every position you compare the distribution of SNPs between those two groups. We actually found several SNPs that were significant, and the most significant one was located in the gene region coding for LRP2. Now, LRP2 is a moderator of the BMP signaling pathway, and that is obviously exciting because we have a SNP that is directly connected to bone metabolism. Yet we can't really say what this risk SNP would do. We don't know whether it would up or down regulate BMP, and hence we can't make any assumptions about the underlying biological mechanisms. But we also found a risk SNP within the gene region coding for the ABO blood system. And here things were a little bit different because that particular SNP has been described as being predictive of certain blood types. So when we plot implant survival, according to Kaplan-Meier, we could compare those patients having at least one risk SNP at that position versus those who did not, and we could find a significant difference. So those patients having the risk SNP would have a higher risk for revision surgery, and also they are most likely of blood type B. This is, of course, of use for the physician who would have to inform the patient prior to the primary arthroplasty about their specific risk for revision surgery, which you could do solely based on their blood type. Obviously, we have to check whether this stands true in epidemiological studies and animal studies with knock-in and knock-out rodents, and I promise to you, I'll get back to you as soon as I have those results ready. Thank you very much.